4th week, I believe it is, the 3rd or 4th week, you'll be given meds. So you'll do that. Why you have to take pharmacology. Guidelines talk about all the skills lab and what you'll be expected to do. I'm not going to insult you, you can look through those. Dressing changes, sterile gloving, those are just, they're called our guidelines, what's expected of you. And I'm going to talk about each of those in the skills lab when I go over all that. You'll do a self-evaluation journal, you'll do a nursing diagnosis, research. You'll do health teaching, we'll go over that later. Problem list, we're going to go over all that later. Medication, epic training, okay, here we are, getting something I want to talk about. Okay, 5.17, HESI. And we'll talk more about HESI as it gets closer. This is the exam that you'll take towards the end of the semester. So, it's really hard to make, let me just put it this part. Most people, we want you to score a minimum of an 850, which that's your C. You see that's a 77. So if you take the HESI exam towards the end of the semester and you make an 862, that means you'll get 39 of the 50 points. So take your HESI seriously because it's a half of a test and it can come back to invite you where you're sitting. So really when you do those HESI case studies, it prepares you to take this HESI exam at the end of the semester. And some of you have already looked at the calendar and you notice it on that very, very last day, it says HESI remediation. And again, we'll talk more about this as it gets time. But, so say you make that 867, that means that you would have to do 1 hour of remediation. This is something you're going to do on your own at home. But we can follow up. We check it several times a day, actually, when it's getting close, to see has Susie done her hour that she's supposed to do based on her exam. And when you exit the exam, we will tell you how much time you have to do remediation. And so we'll be notifying you, hey Susie, you haven't finished your remediation. You only have till whatever that day is, that Tuesday of December to get that done. Or if you don't do your remediation, you can't hang in that. You know what that means? What do you get? Goose egg. So for the HESI, instead of getting 50 points, 0. So nobody wants that. Nobody likes zeros. We don't like zeros. So there's a big long table there that goes over HESI. And there's the thing about Prep U and HESI case studies, and then the rest of that's pretty much just general information, who to go to. Let me get over to that. Universal steps, I'll go that one. 6.5, who to see for what. You see my name, my extension number, my office number. So in general, if you've got questions, you can come see me. If you need to. Your educational plan, a lot of you signed all that. If you've got questions about it, you should see Dr. Lowry. Your schedule, you can come see me. Your nursing skills lab schedule. Any of that. Study habits and testing skills. Your advisor is going to be your best bet for that. And you'll be getting your list of who's who for your advisor. We're working on that right now. We'll probably have that available tomorrow. Attendance, again, I talked about it earlier, that's Ms. Mizell. Test grades, Ms. Murdoch will be in charge of testing. And then Ms. Morrow is actually in charge of the grade book, so she puts our grades in when we get done testing. If you've got car trouble, anything out, you know about calling the security people, and there's about financial matters, and then you've got Dr. Coleman's number there too. So those is who to see for what. And as I mentioned earlier, the TB, hepatitis, all that, Ms. McIndoe, I don't know why I did not get her name right, or myself, either one of us. you can see me as well. And then, let me talk a little bit about community service. Ms. Hamilton briefly talked about community service, the form that you fill out. Because we're, you know, as a human being in healthcare, as a human being in general, community service is very important for you as an individual and for the community as a whole. So at some point during your freshman semester, there's various ways to get it. You have to do 3 hours of community service. You have to do 3 hours of community service during your freshman semester. You will do 3 hours of community service in your sophomore time, which is 2 semesters. So a total of 6 hours, total of 6. That can come in many forms. It can come when we do a blood drive. We'll do a blood drive sometime this fall, probably. They usually do it in the fall. And so if you want to go give blood, guess what? That's your community service hours. You're done. Just go up there, lay your arm out, let them poke you, drain a little blood, eat good before you go. But that's your community service. If you do a health fair at your church or at your synagogue or mosque or whatever, if you do some sort of a health fair, that's fine. You bring some documentation from somebody in charge that says, Susie Smith took blood pressures at our health fair at St. Mark's Baptist Church, and guess what? 3 hours, okay? So sometimes we even have welcome days. We'll have welcome days for freshmen starting in January, and so sometimes we want students to help us with that. So if you're needing those hours. There's all kinds of walks that will be coming up this fall. There's the Alzheimer's, Walk to End Alzheimer's is usually in October. The Susan Komen Race for the Cure will be coming up in October. Those all count. So if you sign up to do a walk or a run or whatever, those can be your community service hours. So just be thinking about what's near and dear to your heart. You know, I always do the Susan Komen race, not that I race. Does this body look like it runs? I don't think so. But I can walk really fast. So, you know, any of those things, you can sign up and get your community service hours. But you will turn those into the Student Services Office, and Ms. Shepherd keeps up with that. And if it's getting towards the end of the semester and you don't have your hours in, she'll send you a nice little email. And you know what, if you don't get your community service hours, you know what that means too? You don't get to register for next semester, and you don't get to be over there. So we want you to be over there in January. You should go there, okay? All right, any questions about the syllabus? Do you know anything I left off, Ms. Oglesby?
No.
Okay. So this is sort of my first time being course leader of freshman. I was course leader of sophomore one last semester. So it's, you know, kind of a newbie as a freshman. I did freshman though for several years. So, you know, I'm not a newbie to freshman, doing freshman stuff, but just a newbie being course leader. So, you know what, if I mess up, please forgive me. All right, let's go over our syllabus for farm. Is everybody okay? Do y'all need a break? Do you need a break? Yes, no? No, you're good. All right. If you need to get up and run to the bathroom, you know what, so, you found them so far, right? Now, what I hear is there's one way over that way over there. It's like around the 1200. Now, this is what I was told, ladies and gentlemen, is that if you need to go take care of some business, you know what I'm talking? You know what I'm talking business. Sit down business. That's where you go. That's what I've been told. Because I went there and they go, oh, Miss Manning, I know where you came out of. And I go, it's a bathroom, yeah. And they go, no, this is where you go to do that. I go, oh, I didn't know. I'm just saying. So, you got to do the business. You go way over there. All right, so we're going to talk about pharmacology. I told you I was crazy. We're going to talk about Pharmacology 1. Pharmacology 1 syllabus. And I'm gonna skip a lot of it because it's exactly what we just had, somewhat, there's that. Here's your list of lecture outline. I'm not gonna go over that yet. Let's see. Your course description is here. There's 42 hours of theory, and then skills lab just 3. You're thinking, well, how does that work? Your dosage count comes out of that, and I'll talk about that in a minute. And then when you're actually working on giving meds, we'll have the Pyxis machine, which is our medication dispensary system. Those are your skills lab hours for farm. Learning outcomes, demonstrate about medications and thoroughly know how to administer medication, being very accountable. I'm not real persnicked about a lot of things. Obviously, you can tell I'm a pretty laid-back kind of person. But medicines, I'm persnicked about. Because you know what? We can kill people. Kill them dead. Dr. Jett, that you'll have next semester, says DEAD, dead. And so I'm real persnicked about medications because, really we're giving people poisons. And so, it's serious business when it comes to pharmacology. Again, here's syllabus. Here's our names that are going to lecture. The same people that are lecturing for you in adult nursing 1 will be lecturing in pharmacology 1. We all take turns doing things that we love. We have certain things that we love, and you will too. I'm a big heart nurse. I love cardiology. And I like wounds. I like yucky wounds. I know. I love it. I'm sick. I love colostomies. That's really weird. But I do. My most favorite patient I ever had the worst smelling colostomy I ever seen. And the only reason I wound up caring for him is because I was the only one that didn't throw up in his room. And ever since I love him. So again, here's some of the learning outcomes. Here's about the cheat. Here's the range for the grades again, just like we talked about earlier. Here's about attendance. When we talk about attendance, it is all combined. So, if you miss a little in farm and miss a little bit in theory, it's all added up together. And there's about skills lab. Now, we don't have as many exams for farm because it's only a 2-hour course, whereas the other is a 10-hour course. So you have your first exam. I saw there's got in August, and it's mostly going to be on what Ms. Feller and Ms. McIndoe will be teaching you the next several weeks about medication administration. That's what your first exam is going to be about. Exam 2 will be kind of general pharmacology. They're all about an hour lectures for the most part on different, pain medicines, cardiovascular medicines, infective medicines, so all kinds of stuff like that. And then exam 3, the same thing, and they're worth 80 points apiece, and then your comprehensive final is 80. So altogether you have 4 exams. And then again, your skills lab will just consist of, you'll come in here and you'll play like you're getting meds out of our pieces that we have here. Okay. Now, I'm not going to go over textbooks. Mainly it is for this lecture. For here it is the Hornbelt, which is your dosage count book. And you'll have dosage count pretty much every week. There's one week where you'll have med administration and not have dosage count and vice versa. And then your key book. Those will be your main 2 books that you'll have for pharmacology. And then just like before, here is a list of your lectures and what chapters they will be. So all these first ones are the ones that Ms. Feller, who actually teaches in sophomore 1, which this is near and dear to her, so she's agreed to lecture for us one more time. So those are your chapters for those 3. Course exams, same thing. Exam 1 goes into all of those different things for those first few weeks of farm. Again, here's all of our numbers, our office numbers, and our email address, and there's Ms. Morrow is listed on there. Anything that has to do with dosage count, please contact Ms. Morrow, because she is your queen. She will be the one, she has to hand grade the dosage count exams. And you did get a handout, again, in your welcome packet, that talks about, so many grams is equal to so much this, and, so be sure and be bringing that when you come to class on tomorrow. I keep saying Wednesday, tomorrow. So bring that tomorrow for Ms. Morrow's class. And then skills lab, it's just the same. When we talk about dosage count, I do want to bring this out, is I call it playing basketball at University of Kentucky. Now, there's the other thing that's about me. I'm a big Hog fan. I didn't go to U of A. I really don't. I've given them plenty of money. But I love football and I love my Razorbacks, so I get a little crazy, a few more weeks. I wear red every single Friday, something red. Red shirt, red pants, not a red pants, red shirt of some sort. University of Kentucky, they're pretty much one and done, right? They get those nice good players, that's why they're in the championship so many times. So they go to college 1 year and then they go to the NBA. Well, it's kind of like that for your dosage count. If you study hard, you do really good on your first dosage exam, guess what? You're one and done. You don't have to take exam 2, 3, or 4. You got to make 90% though. That's pretty high. That's pretty high. Notoriously, in the past, about half the class passed the first time. Thereabouts. Okay. The second time, about another 2/3 of the class. And when you get down to exam number 4, we're usually not too many are still here. Exam number 4. I mean, not that they're not still here. I don't mean that. But there's not very many that have to go on to exam 4. Most of the people get it on done in 1, 2, and 3 attempts. The same thing is true, and I didn't bring that out, on the medical terminology as well. You're going to take this medical terminology exam, and you're one and done. You get 3 attempts to make the score. But if you get it done the first time, guess what? When it says midterm test number 2, you stay home, cuddle with your dog and your cat. Except for me, I can't snuggle with a cat. My cat don't like anybody. Except my husband, who gives her treats. He kisses her. She kisses him right now. I don't understand it. I feed her and brush her and she bites me. All right, there's about the 10 about medication administration, skills lab guidelines there. That. Anytime you have any question about anything in the syllabus, please feel free to ask. Here's the who to see for what. In general, Ms. Morrow and myself, again, for dosage count, please don't come and ask me any questions about how to calculate those things. Because I learned a totally different way than what she teaches. And I can come up with the right answer, but I go about it a different way. And I haven't been able to grasp her method. Her method seems good. I'm not that her method's wrong, but I just learned a different way. You know how you learn things differently than other people, and as long as you get the same answer, who cares? All right. So that's good to see for what. Any questions about any of the syllabus so far? Look here, we're doing so good on time. I'm sorry? No, you gotta do it her way. Sorry. You gotta learn it that way. And it's really more thorough than mine, but what is my saying? It is what it is. All right, last thing we're gonna go over, and then we'll take a break, and then you're probably gonna get out of here earlier than you thought. All right, we're gonna talk a little bit about the skills lab pack. We're just going to go over this just a little bit. This is, we haven't done this in the past, but I thought it was a good idea, so I did it. Nobody told me I couldn't. It's always easier to ask forgiveness than permission. So I just want to, I want to just let y'all have them real early, because then again, you can kind of glance through them, and you'll always have them, because a lot of times what seems like happen is like when I get ready to do the wound dressing lecture, I hand out these things, and I'll hand them out again. And everybody that does these lectures will hand out these checkoff sheets, what we call them checkoff sheets. It's not really the guy that works in Star Wars, it's the Captain, Mr. Chekhov. People would lose them and forget to bring them, or maybe they missed class that day for some reason. So I'm giving you, you'll probably get them twice for some things, but you know, I've killed trees before, so I've killed a lot of plants. So, all right, so this is just what we call our universal steps. So anytime you come to our skills lab, we're going to say, these are the things that you always do before you do any procedure. Always. You check the chart for a physician's order. We don't just willy-nilly do things. We do have to legally have a physician's order for stuff. You know, we can't just, hey, that little patient, she keeps urinating on herself. Let's just put a Foley in. Well, no, we can't do that. We have to have a physician's order. You have to call and say, hey, doc, you know, Miss so-and-so, she's getting a breakdown. Can we put a Foley in her? Or she's going to surgery. Can we put a Foley in her? We call them Foleys, or urinary catheter. But all of the other nurses call them Foleys. But so, we check the chart for a physician's order. So when you come to our skills lab, we're going to say, what are your steps? Well, I checked the chart for physician's order, okay? I've collected my equipment. So before you go into a patient's room, you always want to get everything, because, you know, as you get older and you get a lot of patients and you become a real nurse, you don't want to make it. You don't want to make it because of these steps. It may be nice. I was nice in here and I got a lot of steps while I was with my Fitbit. But when you're a real nurse, your feet are getting pretty tired pretty quick. So always collect your equipment and take it with you to the room. So collect the equipment. Wash your hands, number one. What's the number one thing that we can do to protect our patients? Wash our hands. When I talk about washing hands, you know, soap and water, happy birthday to me, happy birthday to me. We'll talk about that later. But how many have you been in the hospital? Let me just get a show. Oh my gosh. Well, I'm hoping some of you have children or something. That's why I have that many. But did you happen to notice nurses that came in and out of the room, or physicians or healthcare workers? What did they do? Did they all wash their hands? They didn't, did they? Most of them probably did. Yeah, they have the stuff by the door, and that counts. That counts, the alcohol gel counts. But just kind of be watching. You could be in a clinical setting for too long, and you'll be noticing. Here's a real neat thing to do. I had to do this when I was in school at UCA. Now it's a little weird for guys to do it, because they think you're a creep. But women, you know, we go to the bathroom in packs. You know, we're like a bunch of dogs or something. We go to the bathroom in packs. You just take your friends. We go to the bathroom. And so just kind of go to the bathroom and just kind of hang around, you know, put your lipstick on, get your eye makeup or something, and just watch how many people go in and out of the bathroom. It's pretty amazing. Or sometimes you've been sitting there and you go, that person just went out with their hands. So, you know, just kind of do a little experiment sometimes. So washing their hands, so very important. Identifying the patient. Do you want to put that catheter in the wrong patient? No. You get to go see the people over at the State Board of Nursing when you don't identify your patient sometimes. Explain the procedure. You don't want to just go in there and stick something in a patient without explaining it to them. Ms. Smith, I'm Susie, I'm your student nurse. We're going to do this, this, and this. So you always want to identify and explain your procedure. Provide for privacy. You know, nobody likes to have all their business exposed. So, you know, you always pull those curtains. Set up your equipment, utilizing body mechanics. You know, most of y'all are all young. All of you are younger than me. And you hurt your back if you don't take care of yourself. You got to take care of yourself, because Nurses are notorious for getting hurt. We're notorious for getting hurt. Picking up patients, and we do it to protect them many times, but protect yourself where you can. Raise the bed up, and we'll talk about all that later. Utilizing medical sepsis, and again, washing your hands, making sure all your equipment's clean and opened and that sort of thing. Utilizing personal protective equipment. That's good. You're going to learn how to put on PPE that first week in skills lab. Very important nowadays. Everybody and their dogs got what we call MRSA, which is methicillin-resistant Staph aureus, or staph infection. And so every unit you're going to be on as a student is going to have an isolation patient. I guarantee you that. And so you've got to learn how to put on those things to protect you. Sometimes we're not just protecting us, we're protecting our family as well. Who wants to take home some nasty bug to your little girl or little boy at home? Or your mama, or your daddy, or your significant other, or whatever it may be. You got to protect yourself, and you got to protect the other patients as well. Collecting use, providing comfort. We may have to medicate patients before we do things. Rearranging, keeping things clean, and then you always document whatever it is you've done, and then you evaluate how that went with the patient. So, and I'm not gonna read all these. They're all listed. Like next week, we're gonna do hand hygiene, non-sterile gloving, isolation demo, making an unoccupied bed. We gotta do them little corners. Some of you that may have been in the military, this is going to be a piece of cake for you because you got them out of those corners. And it's you think it might be hard, but I've even taught my husband how to do it. He does a very good job out in the corners now. And I had to do it in my house. Making an occupied bed, even putting a bedpan on people. It's not a fun place to be. I always say, if God wanted us to use one of those, He'd have made us different. But nevertheless, sometimes you have to use it. There's complete bed bath. There's a lot to that. We're going to talk more about that tomorrow afternoon. But anyway, you'll see all these different things listed that you will be doing this semester in our skills lab. Transfer. Now this is everybody's favorite. An enema. Yes, I know you want to sign up for that. We all like doing those, said no nurse ever. But it is a necessary part. You've got to learn, well, and you know where the part goes, hopefully. But it's very important that we learn how to do it properly because you can damage tissues and hurt people if you don't do it correctly. There's different enemas that we'll learn about. Getting specimens, again, not a fun thing to do, but we do have to collect specimens because they need to go down to be evaluated for various organisms or see if there's blood or different things in different specimens. And again, we're going to talk more about them. In some of those videos, you'll see some of that. Yes, ma'am? Well, guess who didn't copy very well? Okay, well, you know what I'll do is I'll take mine and I will make new copies. And so tomorrow morning when you get here, just pick those up on your way. I'll chunk all the rest of them. So just chunk yours and I'll just make all new ones, okay? So just chunk them when you get home or out the door on your way out. Physical assessment will be one. Now, when we get into physical assessment, you're going to have these all kind of boom, boom, boom. Those are the first weeks. When you start getting into physical assessment, it even says physical assessment practice or something like that on your calendar. 1 week you're going to practice, the next week you're going to do it. You'll check off with an instructor, okay? So there's physical, and this is not all. This doesn't tell you how to do it, this just kind of gives you a glimpse of what it should look like. We don't make you, well, I'm not talking about those personal areas. We won't make you check those out. Let you tell us what you would look for. Sterile gloving, dressing, this is exactly what we grade you on. So you know when you come into the skills lab, this is what we're looking for. right here. These are the things that you will need to do and, or you'll need to tell us about. You know, you would say, well, I would gather everything I needed. I would check the chart. I would do all that sort of thing. Here's catheter, and catheter is the very last thing that we do. It's a little more detailed to the catheters. All right. So go ahead if you want, you can chunk that, and I will make all new ones for you, since we don't know what all is missing. And I'll have them available for you first thing in the morning, okay? All right, so it is 2:18, so why don't you take a break till 2:30? I will let Ms. Mizell know that you are ready, and she will start lecturing at 2:30, okay? Intro to